Hello again everyone, and welcome to my YouTube channel, where today I'm going to be talking about substance use and mental illness in children and teenagers. My name is Tracey Maxfield. I'm a nurse, author, peer consultant and staunch advocate for stop bullying and mental health awareness in our children and teenagers. And so if you've been following my previous YouTube videos and blog posts, which incidentally can be found on my website www.traceymaxfield.com, you will know that I've been going through brain function and what changes occur that will result in the possibility of a child or teenager developing a mental illness or mental disorder, the effects of bullying and social media on our kids and what that can also do to the brain. And so today I would like to go a little further and talk about substance use or abuse. I'm going to try and avoid using the word abuse because of the negative connotations. Substance use disorder is a very serious condition, and it is actually increasing in an alarming proportion amongst children, believe it or not, and teenagers. When we think of substances, we're talking about cigarettes, marijuana, alcohol, vaping, opioids such as heroin, fentanyl, and cocaine or crack. Now, lots of you are very familiar with the opioid crisis that we have currently, not only in USA and Canada, but also in the UK and globally. It is an epidemic. And what we are finding is that many children and teenagers are in fact using fentanyl primarily, and also carfentanil, which is even more potent. And yes, they become addicted to it, but they also develop what we now term as a substance use disorder. And so I guess the question that we all have to ask ourselves is, what comes first? Mental illness or a mental disorder in our kids, or a substance use disorder, which then leads to the mental illness? And there's actually no clear answer because both can contribute to each other. So for example, we can have a teenager newly diagnosed with a bipolar disorder who is going through the depressive and the manic stages, goes on to lithium, which can dry up the mouth, make you quite dizzy, nausea, vomiting, leads to weight gain, just makes you kind of feel foggy. You may find that you're not able to concentrate at school, and the teenager may decide that they don't want to take lithium, and so they may actually turn to a street drug to give them relief from the symptoms that they're experiencing, or they may self-medicate and add in alcohol or marijuana or an opioid to their lithium, A, to ease the side effects, but also B, to help them deal with what they're going through. The same is true of a child or teenager who has a depression and an anxiety disorder. And in fact, studies have found that children and kids who have oppositional defiant disorder, conduct disorder, ADHD, schizophrenia, have an increased susceptibility to developing a secondary condition, a substance use disorder. And we actually call that dual diagnosis disorder. If any of you are fans of Dr. Phil, you will see him frequently telling guests on his show, I want to send you to a dual diagnosis treatment center. So what that means is that the person has a substance use disorder plus a mental illness or mental disorder. And treatment will be for both. It's long, it's very intensive, but say, for example, they will be treating the bipolar disorder and the alcoholism. And I think what's important for listeners and viewers to remember is once the substance use disorder is treated, it is a lifelong management. They kind of they go into what we used to call the dry period or the rehab, where if they stay off the substance that they were addicted to and don't try other substances, they will usually be fine, but the mental disorder may in fact continue. So if they had a bipolar disorder or schizophrenia before they had the substance use disorder, that will still be there when the alcohol or the opioids are stopped. Now, I think what we need to really get our heads around is that our kids are doing drugs and alcohol at a much younger age than we ever used to, and they're getting addicted much more quickly and more easily. Now, I'm a Brit, and I remember always at Christmas at age 12, 13, 14, it was not uncommon that I could have a glass of alcohol at special occasions like wedding or Christmas. And I remember actually at weddings it was always a glass of sherry that they used to toast. I don't like sherry, but I do remember at Christmas having snowballs, and that was kind of a cocktail which had alcohol. And in many cultures, like for example, Italy, it is very common for the child, teenager, to get used to drinking Chianti or wine at an earlier age. Does it predispose them to developing a substance use disorder? No, not necessarily, providing there is monitoring and good explanation of the parents and family why they're doing this. But if you have a child or teenager who is already struggling with something like being bullied in school, or is having the signs and symptoms of a mental disorder and doesn't want to talk about it for fear of stigma, shame, embarrassment, confusion, like what's going on, then they take their first sip of wine and find that it gives them a little buzz and they feel good. So the next time they feel like that, they take it again and again, and they go into a vicious cycle, because what you find is you need more and more and more to get that, hey, I'm feeling good, I'm feeling confident, life is okay kind of feeling. Now, what we know with alcohol and opioids is whilst they'll give you that initial rah-rah lift, it will easily give you that down. And in fact, opioids and alcohol are known to cause depressive symptoms. Hence why someone who is a long-term fentanyl addict or an alcoholic, for want of a better word, but has that substance use disorder, it's not uncommon that they will then develop a depressive mood disorder or an anxiety disorder. Teenagers, for example, in the States, a study just recently came out and they found out that 4% of high school seniors were using heroin repeatedly throughout the month, also smoking marijuana. And what that does is it alters the brain function and the brain chemistry. If we think back to the very first blog posts and YouTube videos where I said that a mental disorder in the brain occurs due to factors that happen in utero, genetic susceptibility, and current environment. And if you remember, ACEs, adverse childhood experiences, traumatic events. So if you have a child who is maybe parent is incarcerated, is also being abused in the environment in which they live. They see a lot of drug deals going on, gang activity, etc. That already has changed the brain function and the brain chemistry, which makes that child more predisposed to developing a mental disorder during late childhood, early teenage years. This also affects their susceptibility to developing a substance use disorder. We know that kids are trying alcohol and smoking pot at a much earlier age. They use it to belong, to be cool, but also it becomes a coping mechanism to deal with the stresses of life. So just, the stresses that are going on in school and maybe stresses that are happening at home. And so all these factors combine. Substances affect the frontal lobe, and we know that the frontal lobe is not fully developed in our kids until ages 21 to 24 in a female and ages 24 to 27 in a male. The frontal lobe is decision making, problem solving, executive functioning, determining social and socially inappropriate behaviors. It is your self-esteem. It is your emotional control receptor. And so if that's already compromised because you have a mental disorder and then you take a substance, that is further going to impact it. It'll give it that. So if your self-esteem is low, it's going to initially make it, wow, better, high, I'll take more and more and more. I don't need my medications for depression or anxiety because guess what? I'm smoking pot and drinking wine. I feel great. In order to keep that feeling going, they have to drink and smoke more and more and more to get that eternal level in buzz, and they'll never ever get that. And so that is why you can see how a pre-existing mental condition can then lead to a substance use disorder. And similarly, if you are already addicted to smoking pot and you maybe pop a few pills and you're drinking a lot of alcohol, you then get symptoms of anxiety and depression. And even though you take the medication, it may not be working or you don't like the side effects. And so then you continue to take the substances, but you still have the pre-existing mental disorder, and that is only getting worse. It's not getting better because you're not managing and treating it appropriately. I know it kind of sounds all convoluted, but just think back to the brain. We know the brain is not fully developed, and so your child, your teenager, is susceptible to so many environmental factors that are going on around them. I apologize, I'm in a hotel recording this, so you can probably hear a little bit of activity in the hallways. And now here's a train. Yay! I have train tracks outside my room. Anyway, please read my blog post in much more detail, and talks about management techniques and statistics. And please consider subscribing to my YouTube channel by pressing the button below and then go into the little bell that you see, clicking on that icon so I won't have to keep harassing you with texts and messenger and emails. Anyway, next time I'm going to be discussing what actually happens if we ignore the fact that our children and teenagers have a mental disorder or mental illness. What can actually happen to them? And it's not good. Anyway, thank you for being patient with me as the train rolled by and people passed in the corridor. I will talk to you again next Monday. My name is Tracey Maxfield, and have a good week.